Hi, welcome back to Med and Me. My name is Shrija, and today we're going to be interviewing Dr. Goodlow, who is a doctor of nursing practitioner. So, would you like to introduce yourself?
Yes. Hi, my name's Tranise Goodlow, also known as Dr. G, the DNP.
Okay, so just a little bit about what being a doctor of nursing practitioner is.
Sure. So, DNP or Doctor of Nursing Practice is a terminal degree that nurses can get within our field.
Mm.
There are a lot of different options that are available to you, whether you want to practice or work in academia or work in research.
Which one do you do?
Um, I initially started out in clinical practice, and now I currently work more on the research side of things.
What education, so undergrad or uh, like what degrees did you get?
Sure. So there's really two trajectories you can do to obtain a doctor of nursing practice. Everyone has to have a bachelor's degree in nursing. So obtain your BSN for undergrad. Some individuals opt to get a master's degree and then go on to a doctoral program. The program I went to, I entered with a bachelor's degree and I finished with a doctorate. So I do not have a master's degree.
How long does it typically take to get the doctorate?
Um, Varies whether you go part-time or full-time. I went full-time, no breaks, summers and all of that. It took me roughly 3.5 years.
Is there a specialty that you can kind of get, or is there something that you yourself like focus on, like in terms of medicine?
Great question. So the school that I went to, I obtained my doctor of nursing practice, but also has a specialty as an adult gerontology acute care nurse practitioner.
Hmm. And why did you choose to become that, or like motivation behind it?
I always had an interest, even when I was a floor nurse, into cardiology, and I knew exactly that I wanted to follow a cardiology trajectory. I worked as a floor nurse in cardiology, and I did my doctoral dissertation in hypertension management. So I always knew I wanted to practice in cardiology.
That's very cool. I'm also interested in cardiology. And then could you tell us pros and cons of your job?
Sure. I actually, over this past year, shifted trajectories. So I'll answer your question twofold. So when I was working as a nurse practitioner, seeing cardiology patients, the most valuable, rewarding part of that was just the patient interactions, building those relationships. I was in outpatient cardiology, so I was able to build relationships and rapport with my patients. They bring me cards and cookies and give me hugs and want to update me on their kids. And so it just made the working relationship so much easier because I had that established trust and foundation with them.
Hmm.
So it really was an honor and a privilege to work in the outpatient setting. To answer your question about negatives, I think all providers would agree with me when I make this statement. Just the time crunch, wanting you to see more and more patients in less amount of time, and people are sicker. 50 years ago, people didn't have as many comorbidities as they do now, and so I remember seeing several patients that may have like 20 diagnoses, and it's really hard to sift through that when you only have a very short amount of time to do that.
And then after you switched trajectories into becoming into research, were there pros and cons of that?
Um, yes. So last year I left clinical practice and I became something called a medical science liaison. And so my job is to be the medical expert in whatever therapeutic area my company wants me to be in. So for my current role, I'm the medical expert in my area in regards to anticoagulation. The pros of the job is it's a lot of flexibility and you're around a lot of cutting edge, up to date. Like you see the new stuff that's coming out, the new phase 3 trials, and it's very exciting to be a part of that. The negative I would say about being a medical science liaison is I miss the patient interactions. When you're providing information and you're disseminating it to healthcare workers or researchers, you are impacting patient care, but you're just not directly doing it. So I miss, for lack of better phrasing, the instant gratification of giving
Yeah.
someone Lasix and then they're diuresed and they love me. So,
Hmm. Um, do you have a certain experience that kind of changed your mindset in your career, or maybe something that made you change into like a different trajectory?
yes, I have spent a little time, well, roughly 2 years. I was an adjunct professor. And I was able to really have an impact on the students, and they left a lasting impression on myself. And because of my students, I started my own entrepreneurial endeavor, and it's called Dr. G DNP. And so I teach nurses and nurse practitioners how to interpret EKGs. That's very important to me, and I've even taken it a step further, and I advocate that patients at least have a baseline EKG done at least every 2 to 3 years, if not annually, with their PCP, because heart disease is a leading killer in this country. So I think it's very important that we have providers that are comfortable with EKG interpretation. So I guess I've taken my degree and ran with it, if you will.
Oh, that's really inspirational. Um, okay, so what kind of person would you recommend this job for?
Oh, wow. I believe anybody who gets into nursing has to have compassion and love for people.
Hmm.
We are honored and privileged to be with people when they're at their worst, because when you're at your worst, you really need someone to lean on. So I do not take it lightly that patients have trusted me with monumental health decisions. They've sought my counsel, they've sought my advice on how they should move forward in whatever their disease process is. So I think you have to have a love of people, you have to have compassion, you have to have patience, you have to have a hunger for learning. You never know everything. No one knows everything, but you have to know your limitations and then seek the knowledge out so that you can excel at your job.
Hmm. Um, what did you not expect about the profession that you found to be true? So something that like you didn't expect.
Hmm. Um, I guess I did not expect, particularly being a nurse, I guess kind of to be an afterthought. I
Um,
think a lot of what healthcare is focused on is on patients, which is rightfully so,
mhm.
as well as physicians. And nurses make up the biggest sector of healthcare. So it's frustrating to me that nursing doesn't necessarily have a seat at the table when we should have a seat at the table, because without nursing, the whole healthcare system would just combust.
Yeah. Yeah, I think a lot of the negative stereotypes are just really like unthoughtful and unthought of. Okay, and then how do you balance your career with other commitments and interests, like your entrepreneurial endeavor?
It is certainly challenging. I will say that becoming a medical science liaison has given me more flexibility. So
Hmm.
I may work some odd hours, but it's been nice to work in that sense. That way, I'm able to pursue my entrepreneurial aspirations as well. I will also say I'm a big advocate of being physically active and physically healthy. Just actually 3 weeks ago, roughly 3 weeks ago, I competed in my first ever powerlifting meet, and I won first place in my division. Um, and so, yeah, it was a thrilling experience. But I'm very a big advocate in health, because I can't speak for others, but I will speak for myself. I personally don't feel comfortable giving people medical advice if I'm not healthy. I think that that is a walking contradiction. And I want to lead by example, and I want to show people that it's possible. I have a full-time job, I have a business, I have 3 children and a husband, and I still make time to power lift and be
Yeah.
active and take care of my health. So
Okay, and then could you walk us through a typical day being a medical liaison?
sure. So being a medical science liaison actually varies by the day. Just I think back to when I was working as a clinician, it was pretty standard. You're seeing patients and you're dictating, and that's it. But being a medical science liaison, it varies. There may be days where I wake up and I'm prepping for an appointment where I have to present data to people at the hospital or whatnot. There could be a day where I just have a bunch of internal meetings. There could be a day where I'm just straight traveling because I may be traveling to a conference. Once I'm actually at the conference, I'm there all day interacting with people, learning about their practice, learning about their health system, and then figuring out a way how I could partner with them to get ultimately best patient outcomes. There are days when I'm just in my office and I do administrative time where I'm doing expense reports, answering emails, reaching out to colleagues, that sort of thing. So it's very varied. My day is very varied.
Hmm. Okay, and then last question. Do you have any particular tips for high schoolers or in general that would like to be either a medical liaison or a DNP?
Um, yes, I think that you have to have a curiosity about you. I think that you have to have a focus about you. I will say, particularly being a doctor of nursing practice or even a nurse in general, nursing is probably the most flexible career that you could ever have. Typically, a medical science liaison holds a PharmD. They're typically pharmacists that are medical science liaisons. However, the field is shifting and they're starting to look at providers such as, advanced practice providers, even physicians, because they value our clinical background and our knowledge working with patients through the year. We're seen as an asset. Um, so I would say that. And the last thing I would say is don't limit yourself. There was a time where I thought I wanted to do pediatrics and I had a pediatric rotation and I realized this isn't for me. So I would say be open with your journey. Don't pigeonhole yourself to say, oh, I have to do this specialty. I have to do this specialty. Just experience it and then gravitate to what pulls on your heartstrings.
That was really great. Thank you so much.
Thank you.